Eliminate your hospital's admissions deficiencies with the evidence-based SHH system, proven to reduce hand-transmitted infections.
Well, I had read about a lot of instances of people getting infections in hospitals. So I thought, well, gee, maybe I should come forward and talk about it. The sort of germs that you get in the hospital are very strong, and the second reconstruction is where I got the 5 infections. One was a staph infection, and then there were 4 others that it was just unbelievable. They kept finding these infections. And another doctor told me too that it was post-surgical. So in other words, it was because of the surgery that I got the infection. It's just that there's so many things going on in a hospital that it's so easy for stuff like this to happen. I think that that you get real busy, and nurses are so busy. I can't believe how hard they work, and I can see people forgetting to do things like that. So that was at least my experience.
Hi, my name is Fortune. I'm here with my son Shane, and I'm here to talk about the MRSA staph infection that he's had for the last year. They're probably quarter-sized boils to where he can't walk. I've had it to where I've had to have my neck cut open and stuffed with gauze. I've had it on the side of my eye and on my finger. It starts with like a little pimple. It's red, and then the inside gets bigger and bigger. On the outside of it, it's red, and it gets to about the size of a quarter, and the most vile green stuff comes out of it, pus, and then once all the pus drains, blood, nothing but blood just pours out of his boils. And there's only one medicine he can take out of 20 because the rest of them become immune to the MRSA that he had. And they say the #1 place for you to get it is a hospital. Besides the emotional stress, like it's a mother's nightmare. Other than that, I lost my job over it. Constantly having to go to appointments, UCLA, Santa Barbara, and my job finally said after a year of me being there and dealing with it, they couldn't do it anymore and they let me go. And a mom should be able to always make their kid feel better. That's what bothered me the most.
Protect your hospital from liability that could result in unnecessary claims and costly litigation. Implement a personal solution to an institutional problem with SHHS, SPRIXX hand hygiene system. Institutions responded to the threat of resistant superbugs with wall-mounted alcohol dispensers. Now, the Joint Commission has pledged to enforce all CDC guidelines requiring body-worn alcohol dispensers and the strict monitoring of healthcare workers.
It is more effective than any soap in the treatment of bacteria, fungi, and most viruses. By using the body-worn device, by just spraying some alcohol into my palm and rubbing it onto my hands, and taking 15 seconds to decontaminate my hands versus a minute to a minute and a half, which is how long it takes to wash my hands, I would say it saves me an hour's worth of time.
SHHS is your solution to the global problem of hand-transmitted infections.
Because it's quick, it's easy, and it's always there. I just reach down, it fits right into my hand just like a cell phone or a pager, 2 squeezes, and I have all the alcohol I need to decontaminate my hands.
This exciting new technology, the SPRIXX body-worn dispenser with electronic tracking, provides protection at the point of care. Protect against the threat of unnecessary claims and costly litigation. Join the World Health Organization's Global Patient Safety Challenge. Eliminate admissions deficiencies with SHHS. We use the IHI Institute for Healthcare Improvement process and create a customized hand hygiene system especially developed for your specific hospital. Learn from our years of clinical testing in hospitals around the country. When a patient has a choice of hospitals, help them choose yours. SPRIXX offers the real solution.